Don't touch that dial. I know this may be shocking, but here's another episode. Already? I'd also like to send a special shout out to my son Daniel for use of his song Middle East Gold for the new theme music. It goes something like this. Welcome back to Talking About Glaucoma, the podcast of indeterminate frequency in which I talk with glaucoma colleagues about hot topics in our field. This is episode number 17 for early August 2011. I'm Robert Schertzer, Clinical Associate Professor at the University of British Columbia Department of Ophthalmology and Visual Sciences and Director of the West Coast Glaucoma Centre in Vancouver, BC, and we're talking about glaucoma. We're talking today with Steve Sarkisian here at the American Glaucoma Society, and he really presented something which I was completely unaware of. And it's nice to be surprised sometimes, and that's this product called Ologen. And it's a collagen matrix implant to be used in conjunction with glaucoma surgery. And I'll have him explain it.
Well, thanks so much, Rob. The collagen matrix, which we're calling Ologen, which is called Ologen, has actually been available in Asia and in Europe for a number of years now. I think the original version was called something like Oculus Gen, and it's a porcine etiology. It's a collagen matrix, and it's been modified several times. There is some European literature that has compared it with mitomycin C and found that the pressure was a couple points higher in the Ologen group than in the mitomycin C group. Perhaps a difference of between 15 or so in the Ologen group and somewhere between 11 and 12 in the mitomycin C group. But the key difference was that the blebs looked so much better in the Ologen group, in that they were not avascular and thus prone to all of the dreaded long-term problems that we're so concerned about. So what the company did was they now have a version that's a telocollagen, which is just been treated differently, and it's been partially digested collagen, and it's therefore it has less immunogenicity, so that's the version that we have now that we know is Ologen. And I've reported at this meeting my preliminary results of 36 patients with 1 year follow-up, defining success as between 6 and 21, and my success rate with the 36 eyes was 94%, and my qualified my complete success rate was I think about 84%. So about 84% at 1 year on no medications. So the real key here, if you look at this, and this meeting has been really interesting because you've seen in the morning of surgery day all this development, and I'm very much in favor of all the MIGs or the minimally invasive glaucoma surgery, and this has been brought about because of all these how much just people hate mitomycin trabs, and I've had many people come up to me and just say, well, I'm so glad that there's another option, and kind of like you said, it's kind of surprise, almost disbelief that there's something else, and so it's exciting, and I've had very cautious optimism coming up to this meeting and knowing that now that we finally have some longer follow up. My case report here is the first case report with the new version. There should be a European paper coming out using the new version, comparing mitomycin to Ologen, that I understand is going to be very similar to what I've reported here. And then a prospective randomized trial, multi-center U.S. study will be shortly underway. It's pretty much out of the IRB phase and on various, depending on which institution you're at, and my institution we should start recruiting this month. So
that will go head-to-head with a trabeculectomy, or is it an express shunt trabeculectomy?
My results thus far have been with express, but this randomized trial is going to be trabeculectomy. Yeah, it's going to be trabeculectomy, mitomycin versus Ologen with trabeculectomy.
So is this approved now for use, or I'm assuming safety has been shown?
Yeah, it is. It does have FDA approval for wound modulation in the eye. And interestingly, collagen is something that's been used to modulate wound healing in the body for a number of years. There's been the plastic surgeons have been using it. Burn surgeons, burn doctors have been using it to help modulate wound healing. There's a dental application actually. So it's been often used to treat wound contractures. In ophthalmology, it's one application is treatment of pterygium, and another is for strabismus surgery to help prevent the scarring at the area of the muscle surgery. So those are other ophthalmic applications for which it can be used for.
And to make things clear, this isn't like the collagen wick that we've used in ophthalmology. This is just a very flat, porous sponge. It looks sort of like an instrument wipe that's put on the scleral surface. That's
a good analogy, or the corneal shields, the circular corneal shields. It kind of looks like that, and that's a good analogy, and it feels it has a very sponge-like appearance, and it's pretty easy to manage. So the main issue now, like any new technology, is going to be the cost, because it's about $200 a piece. And when you compare it to mitomycin, which is somewhere between $50 and $80 for each application, it does add to the cost of the procedure. And so once people sort of are forced to analyze it for their own patients, and they see the benefits of it, that's really going to be where the discussion is going to go next. And I'm not quite sure what the best answer is. I'm not sure what the most appropriate answer is.
Right. It's one of those things where your operating room isn't going to see a return on investment on it in that way, but the complications that will be reduced by not having these thin mitomycin blebs and endophthalmitis and wound leaks in the future is something that you have to factor in big time.
Well, yeah, and I honestly, I've just been making less money on. My surgery centers are making less money on every case because it's eating into their. I assume it's just eating more into their facility fee, especially for the Medicare patients, but I think that I suppose for the sake of science that we're trying to. I'm not really concerned about that. I'm mostly concerned now of getting some data out there that can help people, because this is an exciting thing. I mean, this is something that we can't keep under a bushel, and I'm not going to let the cost factor inhibit progress here. So
yeah, well, sign me up for the trial. Thanks so much, Steve. Steve Sarkisian here at the American Glaucoma Society. If you like this podcast, please subscribe via RSS feed from mywholelotofrob.com blog, iTunes, or the iHandbook app for the iPhone or Android device. Follow Rob Schertzer on Twitter for my latest updates, and check out my office website at westcoastglaucoma.com. Feel free to drop me a line at podcast@iguy.org, that's IGUY.org, and to rate Talking About Glaucoma on iTunes. Please help detect and treat glaucoma by keeping yourself informed. Canadian ophthalmologists, here's an important update regarding Royal College continuing professional development that will help you earn even more credits. With the new simplified CPD system, each podcast episode is now worth half a credit in the new Section 2 under Podcasts. This is not half a credit per hour, but half a credit per episode. You can also use any podcast to inspire you to learn more about a topic and earn even more CPD credits, because personal learning projects are now worth 2 credits per hour instead of just 1. This means if you spend an hour reading up more about the topic discussed today, then in addition to the half a credit for listening to the podcast, you can claim 2 more credits as a personal learning project on the subject.